Hi, welcome to this video. Today we're going to be talking about the right spermatic vein. If you stick around till the end of the clip, you'll see how I perform an embolization of the right testicular vein and all the tricks that goes with it. Thanks. Okay, so here we are looking at the frontal view of the human body, and just gonna zoom out and put all the layers together so you can understand where we are. So this is as you see, human body in frontal view. We're looking at all the elements, and I'm just gonna start peeling off the layers so we can focus on the topic of interest today, which is the spermatic vein and how interventional radiology can treat them without surgery. You know, the well-hidden secret that nobody knows. So we're here to tell you about this secret, especially if you're a young man and you're afraid of surgery or you have a little bit of concern, which is absolutely normal. So embolization is a procedure that is developed by interventional radiologists. We use it to treat any vein in the body. We are experts in vein treatments in the lower extremity, the legs, the central venous occlusion and problems. And really, this is one of the easiest procedure for interventional radiology, but it has tremendous benefits for the patient. So the vein, the testicular vein, are part of the venous system in general, as we see here in blue, and basically their role is to bring back the blood flow from the testicle to the general circulation. Now, how are they organized? So typically the left testicular vein, as we see here, will drain the blood flow and will go all the way to the renal vein. This is the renal vein, the vein of the kidney, the vein of the left kidney, and that little vein here is the vein that brings back the blood flow all the way down from the testicle to the left renal vein. Don't ask me why. God made it like that. Okay. Well, actually, there are, I'm just getting here to there are embryological explanation, and this is how the human body develops. So the problem here, as you can see, you can imagine the force of gravity here pulling the blood down, and you need the integrity of the valve system of those veins to avoid blood refluxing and stagnating in the testicle, causing all the problems that men with varicocele know: the bulging, the bag of worm, the pain, the sensation of warmth, and ultimately that will affect the testicle and cause atrophy, which is like hypodevelopment of the testicle and leading to decreased testosterone levels. So this unfortunate condition can start during teenage and go all the way to mid-age. We see it in all ages in men. So the right testicular vein. The right testicular vein is seen here. This is the right testicle, and I'm rotating this. As you can see, will progress, but instead of going to the right renal vein that we see here, this is the right renal vein, it will go and attach directly to the inferior vena cava, the biggest or the largest vein of the human body that goes inside the belly. Okay, so why is it important? Because that can make the catheterization or the access to this vein by interventional radiology a bit challenging, because it kind of stays a little bit invisible. It's hard to see, so it needs some techniques and skills to get it. The good news is once we get into it, the treatment is really does not differ from the left side and is as efficient as on the left side. This is the vein. So these veins, when you have reflux, they will enlarge, they will get filled with blood, and they cause stagnation and reflux of blood into the testicle. The other thing, this will cause the testicle to heat up because this blood will stay there, will not go away, and one of the mechanisms to have a good function of the sperm cells is to have a certain body temperature which is below the human body temperature. It has to be a few degrees below, otherwise those cells don't function well. That's why the testicles are outside of the body and not hidden inside. And you see, this is one multiple reasons why these conditions should be treated. So again, we will show you an example of how we treat that very easily with interventional radiology techniques called embolization. Thank you. So here we are looking at a diagram that shows us the position of the testicular vein, and we're going to be taking a look specifically at the right testicular vein. So here, this is like a model of a human being, as you can see here, and we're going to be taking a little bit the layers out so we can see what's going on inside. So as I remove the layers, we're gonna focus on this video on the on this part on the right testicular vein, and I'm removing a little bit those layers, and I'm gonna just zoom a little bit. So here's the right testicular vein as it drains the blood from the right testicle. It kind of courses inside the pelvis. It's actually a little bit, gets deeper a little bit, and posterior, and runs deep by the behind all, you see the bowels, almost on the side of the colon, or the spine column. And this vein is particular because it's not going to go to the renal vein as we saw on the left side, but rather it's going to attach directly to the inferior vena cava, which is the largest vein of the human body. So what's the consequence of that for specifically for the embolization, since we're talking about embolization? Well, it can be a little bit challenging for the interventionalist to find it, as opposed to the left renal vein, left spermatic vein that arises from the left renal vein, which is fairly straightforward and easy to find. This one can sometime, in some cases, not all cases, can be a little bit tricky to find, but there are some techniques that we use to retrieve it. So here you go. This is like you can see it here from the side. This vein can cause a tremendous problem in some men because it caused the blood to reflux all the way down to the testicle, causing heaviness, infertility, pain, and sometimes it lowers the testosterone production, causing what we call hypogonadism, which makes the sterility even worse. The good news is, once we again can get into it, the treatment is super easy with embolization. Just a reminder, this is a technique performed by a physician called Interventional Radiologist. It's not performed by surgeons. It basically treats the vein using minimally invasive techniques, either with sclerotherapy or embolization. The advantages are, it's non-invasive. It's like a venous stick under local anesthesia. There's no surgery or skin opening or stitching or ligation. Side effects are almost inexistent. Recovery is immediate. Thank you. Hi, welcome back to the channel. In this video, we're going to discuss a little bit how we embolize varicocele, again due to popular demand and a lot of question from the audience. Apparently there's a lot of people interested in this technique, which is considered one of the easiest technique in IR, to the point that not many interventional radiologists want to even publicize this. But since there's a lot of people who are interested, and I do understand that we are not against surgery in this channel. I have all respect to our colleague surgeons, and we definitely these techniques, the surgical techniques, are very, very efficient. It's just that there are some patients who would like to know more about non-surgical alternative, and that's the purpose of this channel, is just to purely educate the public. So this young patient had already had surgery, classic surgery, ligation, which failed. So he was referred to us because of recurrence of his varicocele. So one of my colleagues treated his left side, and you can see here the course on the left side of his varicocele. So during the course of the follow-up, he presented with persistent symptoms on the right side, and he was complaining of a lot of pain on the right. So we decided to go ahead and do a right-sided varicocele. So most of these varicocele, they do happen on the left side, and it's fairly easy to treat them once they happen on this side, because the anatomy is like the same. However, the right side can be a little bit challenging to the operator, and the vein can be a little bit sometimes difficult, like in this case. So we had to resort to special catheters, like you see here. It's a white curved catheter that I use for the right side. And even with that, we were looking, and it was very difficult to find that vein. So how did we solve this issue? So here you see my catheter just doing a venogram on the right renal vein. And in this case, we had to go a little bit, do a technical trick where we had to go inside the veins that are called the perirenal vein, or the veins around the kidney, and they happen to communicate with the testicular vein. And this allowed us to produce a map of the origin. This is the testicular vein here, so at least we had an idea where it was coming from, and this allowed me to kind of pinpoint a little bit to know where the origin is. So you see, this is the renal vein. It was a little bit underneath it, and then once we know what it is, we can then try to catheterize it, and then that's what we did. Once we found it, we knew where it's coming from. It was fairly straightforward to catheterize it. Then the rest is the usual technique of embolization. As usual, we get selective with the microcatheter, and then we do a venogram that shows the reflux of contrast all the way down to the testicle. This is the right testicle of the patient, and this venous reflux that was causing trouble and causing the patient pain and infertility and all these symptoms. Again, see a venogram and the reflux of contrast all the way into the right testicle, because these veins have lost their normal valve mechanism. And this is the interest of the venography. This is why we are superior to surgery, because once we do these venogram, we can see all the veins in one snapshot from the testicle all the way up to the vena cava. So you can see here there's a main vein, okay, going, and parallel to it there's another vein that communicates through tiny channels, tiny collaterals. So if the surgeon, let's say, he found that this vein is the main culprit and ligate it, he may leave behind another vein, may or may not, so that could cause recurrence. So this is the main cause of recurrence after surgery. Of course, this issue is not relevant with IR, because we see all the veins, and then once we see them, we can start, as we are doing here, we put coils to block them, and it doesn't take much coils. I don't like using sclerotherapy because it can have sometimes unpredictable effects, can go into veins that we don't want to. Second coil was placed. I'm going fast forward here so I don't take much of your time, and then another coil. So here we're going to come to the bifurcation between the two channel. I'm going to use another type of coil that has what we call the liquid metal effect. Where it goes, it can find different type of channels and close different multiple venous tributary at the same time. So here we went into the other vein, the parallel vein, that could have, if left behind, it could have caused a recurrence of symptoms. Again, this is not a problem with interventional radiology because we see all the veins, we do a mapping, and this is the core that I told you, the liquid metal effect. So it occluded this vein, and then it's going to go to the other vein to block it, and that's it. At the end of the procedure, that's it. We pull out everything, the patient gets a band-aid, he went home, same day discharge, no incision, no scar, no general anesthesia, no side effects, no problems, no pain, fast recovery. He was back to work the next morning. He didn't feel anything. It was just like almost going to the lab, getting some blood work. Ultrasound done in few 1 week later, a couple of weeks later, it showed that the varicocele has disappeared, and as well as patient symptoms. So this is a illustration of the challenge in right side. It can be difficult, but relatively easy once you find the vein. It is still this procedure, in my humble opinion, beats surgery because of all the above mentioned advantages. And also importantly, there's a mapping, a visualization of all the veins, so we can prevent leaving a vein behind. Second thing, there's no risk of ligating anything that we should not ligate and cause a hydrocele, which is accumulation of fluid in the testicle. I hope you liked it. If you have a question, don't hesitate, leave a comment. I try to answer all the questions. Subscribe to the channel, give me a thumbs up, and I see you next time. If you have anything that you would like me to explain, please let me know. Thank you very much.